overview of eCare pathways. This is the landing page or the dashboard of eCare pathways, and you can see in the upper two bars, you can see the logos of the organization and the addresses, and in the second bar you can see uh, the help resources, and then user information. After that, then you have um, patient finding inputs, and in the left hand main uh, menu you can find the different menus which can lead into different main modules, and in this area you can see the main content of the page. Now this blue color two bars will be available in almost all pages, but this content area will be changed according to the module that you are uh, browsing. And about this dashboard, there will be a different module which would discuss more. Please go into that module to get more details around that. Now I'm going to talk about this, uh, how to initiate patient registration entries and how search can be done to find your patients who are registered under your organization. Now, these search inputs, you can see there are different sources that you can search. You can search according to the system ID, organization ID, Medicare, first name, and last name and first name together having a comma separator, date of birth, address, telephone, mobile phone number, and email. Now, for instance, let's search from the uh, last name. I'll give this name as my last name, and now I got this patient, uh, which we have already information here. So about this search page or the patient list, there will be a different module. Please go to patient lists or search/list module to get more information around this. But here I'm just showing how patient is registered and what are the details that you can capture under the demographic section of the patient. I'm going to this patient, clicking this go button, and once I'm there, so once I click that button, uh, I will be directed. It will be directed into patient profile. Uh, about patient profile, there will be another different uh, module which would discuss more in more details. Uh, and this From this, of course, we can go into patient demographic information, clicking this particular button. And once you click that button, and you can see uh, patient registration information with organization ID, uh, title of the patient, and all basic information of the patient, including address, country, uh, zip code, email, telephone numbers, and uh, date of birth, etc. And here we have a patient. Now, in this patient, of course, you can see the countries there, and as well as what's the state. It's according to the country. There might be different names that which are used for those jurisdictions. Might be province or state. And sometimes there are districts where health is providers according to that particular local district, so that you can capture that as well. And then sub districts or area where the healthcare is provided, that's captured as well. Uh, then uh, Information like this, and there's gender as well as birth sex of patient. If patient has changed his sex, sorry, the gender, after birth. And then we have information captured from the patient side, which patient can see this information if you allow the patient through their consumer partner mobile app, which would be discussed in different module. And then patient can comment on if there's any problem with the information that they can see there. Even we can you can see what patient has entered in their mobile app, uh, what demographic information they have entered, and what are the differences, what are the discrepancies, and you can edit your own records according to patient entered data. Now, in addition to these main entries, there are other entry category as well, which has a number of very important demographic information like marital status, citizenship, and even you can record death details of if somebody has died, and then how the Medicare numbers, insurance numbers, and then information about the carer, uh, occupation, language, next of kin, and then information about the guardian, about patient's routine GP, emergency contact numbers, and uh, uh, those information you know are mainly captured here. But in addition to those, there are additional entries which organizations can set themselves, something like education level, and this sort of example that you can. But in the number of fields that you can set for your organization is unlimited. So according to that, whatever the things that you want to capture, which will be captured here without any problem, and that these entries can be set very easily, which should be covered in a different module um, under um, patient registration. Um, so now, in the next module, we'll see how data patient registration is entered, and then how these are edited and viewed and deleted. Thank you.